this is Harpo, and he's a 13-year-old Dachshund. If I were him, I'd be grumpy. He's made it 13 years and he's never had a problem with his back. And then he hits 13 and now he has a back problem.
There's several factors that I feel come together when you're doing an MRI. It's the machine, and we have a beautiful magnet. It gets really nice images. And then it is the MRI technician. And the technicians we have here know this machine in and out. They've worked with it for years. They know how to get the best images out of it when we need them. And I find that that's the difference between MRIs elsewhere and MRI here, is that at any given time there is a radiologist staring at the MRI as it's coming up. We've got a trained, dedicated technician watching those images roll off that takes great pride in producing beautiful looking images that are diagnostic. And then we have neuro, who is driving the case forward, and we're looking at the MRI. And that's against the background of we have an entire anesthesia team dedicated to that particular patient at that particular time. Occasionally there are problems or the concerns, at which point they just bring it up to radiology or myself, and we talk about, hey, what can we reduce just to try and get the images we need, get an answer for the client, provide some sort of therapy for the patient, but also do it in a really quick and safe way so that we're not taking risks and we're not having any delays.
Unfortunately, Dachshunds commonly get back problems, and so they often need surgery. And so he came to us and he did need surgery.
For me to arrive in the OR, I've already spoken to a radiologist, sometimes several radiologists. We've talked about the MRI in real time. We've already spoken to anesthesia before the patient's ever anesthetized. We've talked about our concerns, about our worries. Even if it's just routine, we're always touching base with each other to make sure that once a patient arrives in our care, it is a seamless transition from service to service, and that includes anesthesia, radiology, and eventually into the OR. And for me, the benefit of that is that I know that at each and every step, you've had multiple people making sure that we're doing absolutely the best medicine, the best surgery, the best imaging, and that allows us to provide the absolute best care to our patients.
We are staffed here 24/7, so there's usually at least 3 licensed veterinary technicians here at all times. We also house our patients after they recover here from anesthesia. No one is ever left in this room, and especially our neurology patients, they are always housed in the intensive care unit so that we can watch them, so we can treat accordingly.
So Harpo had surgery a few days ago, and he can't yet move his legs, but he can feel them. And so for us, the next stage is once he begins to move the legs, then we want him to do rehabilitation of. And so you kind of need to retrain them and support them to get back on their feet.
The moment that we roll out of the OR, we can already set up some sort of plan for what the arc of recovery is going to look like for each and every patient. And whilst we often do the same things for the patients as we try and help them relearn how to walk and where their feet are and keep muscle mass going and not atrophying, at the same time it is intensely targeted at that individual patient. And I think that that's where the huge benefit of us working with sports med and rehab comes in. We then get to talk about it and decide, like, what is the actual plan that is going to get this particular patient? How are we going to help Harpo today? And what's that going to look like, not just today and the immediate post-op, but whilst he's here in the hospital? How can we engage his owners so that they feel like they're part of that journey where he is going to need to relearn to walk, but they can do a lot that will actually help him along the way. And it's not just the physical helping them, it is the fact that, you know, dogs like to interact with us, they like to go outside, they like to do things, and I think sports med and the entire team over there recognizes the individual patient and what really motivates them. So for me, that's the huge benefit, is that you have specialties coming together with a slightly different focus but on the same case, and as you bring that all together, that's how we impact a patient outcome. People focusing intently on an individual patient really changes that sort of overall arc of recovery.
There's lots of different options here, including treadmill, really helps with gait patterning, helps improve strength of the patients that might be weak from disuse atrophy as well as other reasons, and then coming up with a plan for owners to continue in home, because it really is important to continue rehab in home for them, and they really are key in the recovery.
This entire team starts when they arrive in the front door, whether it's an appointment or whether it's our emergency room. We go through all of these different specialties with us moving them forward. They end up in our ICU, they get wonderful care, and when they finally leave, everybody's been involved in that particular patient's arc of recovery. And then immediately we turn around and we do it for the next case right again. It never gets old providing wonderful care, seamless care for our patients.